You probably know that many countries will get their own state standards for using AI in healthcare. It would be interesting to see what that healthcare would look like. You have the opportunity to have a sneak peek. We will hear about the technology of the future in healthcare from Director of the Center of Smart Health at Tsinghua University, Bin Yang. Please give it up for our next speaker. He will talk about the architecture and technology inside Tsinghua Healthcare Intelligent System.
Good afternoon, everyone. I'm Bin Yang from Tsinghua University. Do you know Tsinghua University? It is very famous in China, but not that famous in here. Currently, I'm just researching about the smart healthcare. So today my topic is to introduce our work. That's the architecture and the technology inside Tsinghua Healthcare Intelligent System. We call it THIS, T-H-I-S. Yeah. So, and today my presentation will fall into 4 sections. The first one is what's this and how to build this. Then how this works, and finally what's the future of our this. Now let's begin from the first part. What is this? I mean THIS. Okay, let's see that. We know health is everything. We just focusing on maybe career, we have work, we have house, we have family. But if you don't have health, you have nothing. But what kinds of health system we need? From a personal aspect, we want somebody to take care of us every time, every moment, and everywhere. And every person can have such kinds of services. But as you know, and it is very complicated. The social, the environment, the psychology, the nutrition, they all the very important factors, they can affect our health. So if we want to give a solution, can manage each one's health, so we will meet some challenges. The first challenge is that what kinds of indicators we will have to manage our health, how to detect them, and how to analysis, and how to do the invention. And the second challenge is that actually for the medical item or the many ideas, we have very clear definition. But for the health, no, we don't have a very clear definition. Maybe you say, okay, I'm healthy because I don't feel any uncomfortable. But who knows whether you are healthy or not? So we still need more study about the health definition. And the third challenge is that we had limited medical resources, but we have unlimited health and medical requirements. And I just give you some example. Just in China, we have about 6 beds, 2.5 doctors, and 3.14 nurses for 1,000 residents. But this is a limited medical resources, but how much requirements we should face? We have 260 million elderly people, and inside them, it is 47 million disabled. And every year, we have 230 million discharged person from the hospital. So we have lots of the requirements. We cannot satisfy all those requirements just using such small amount of medical resources. And then the final challenge is that we are all saying some language, but actually they are not, you share the same meaning. So how can we just stand on the same understanding about the health of the diseases to talk about that? So how can we coordinate with each other to show the problems? That will be the last problem. Yeah, because during this process, we still need to consider about the data protection, the privacy protection. Yeah, lots of things. All these things are the challenges we are facing. And I think this is also the problem all over the world. They're the same. Okay, so we developed a Tsinghua Healthcare Intelligent System. We want to use the AI, that we want to involve AI inside. AI to learn the knowledge from the high-level experts to form some intelligence tools or intelligence system, so that the intelligent tools and intelligence system can transfer the knowledge to the low-level doctors or to the families, so we can help them to enhance their self-management ability. So we set up a system, and the first try is just around the Tsinghua Chang'an Hospital. There are about 1 million residents there. Yeah, we just set up this system and can connect different kinds of healthcare services, resources together to provide the services. Okay, we can see from the right side, and each family, every resident, they can use the intelligence system and intelligent tools to detect their health status and to intervene their health. And also they can help their family members to manage their health. The primary doctor, they can use the AI support system to deal with lots of the requirements from the residents. And then they can go to the services station, and all the services station, they will link to our hospital, the central hospital. Then they go to each station, they can get the same quality, the same level, high quality medical services. Yeah, maybe they go to different services stations, or maybe go to the central hospital to after they get the treatment, and then they can go to the stations, the services station, or maybe go back to their family to do the later rehabilitation services. And if in these regions we cannot show this problem, yeah, we can connect to our medical network. We can ask the help from the international experts. So that's the architecture of our DIS. Okay, from this map, we can see we use this network to link to the original physical institutions. And then, but also we link the health services provider, and also we link the community residents, we link them together, so that in this network, and everybody can be a services providers, and also they can be they can enjoy the services, but they also can be the services provider, so that we can use this system to show the shortage of the human resource and the high quality medical resources problem. Yeah, so what we will do. And it seems that we have a lot of the data resources, and from the central hospital, from the community hospital, and also from the residents, the data generated by them. And then we put them together into a regional intelligent medical information platform. And then we use the unified interface for the management, and the unified resource management, unified process management, and unified quality management. Then we put them together, so and we can develop lots of the application. For example, for the pre-hospital, in-hospital, and the post-hospital. Sorry. I don't know why. It seems that they want to show you. That's the, actually, just now, that image is our, the whole services map we are applying in Tiandongyuan area. We serve for 1 million residents there. Okay, yeah. So we just skip. We go to the next. How to build this? And just now we can see that we have the logs of the services station there. Actually, all this show the first step to build this is to we develop some standards. So we can build, we use this standard to build these stations. And also, the second step is to build our supporting systems. For example, we have the network services, we have data storage services, we have the AI assistance services, and also we have the visualizations management services, telemedicine, VR training, intelligent emergency. And then we would like to set up the operation standard. And finally, we use our digital credit. We create a digital credit system to help to do the intelligent supervision. So that's an example. In the future, these stations, we have some general stations. They can provide lots of the services inside. And we have the specialist stations. We have the rehabilitation stations, and we also have the age nursing stations. We can see the picture, and the left bottom one, that's the community hospital. Yeah, so it is a general station. And we also set up a mobile station. We just put all the services on a car. Yeah, we set up a mobile station. And we also put our system into a drugstore. Yeah, so and some guys in that drugstore, they can enjoy the medical services. For example, they can go there. We can help the resident to set up their health record and also to monitoring their health. And we help them to using our internet hospital services and discharge services and everything. And also we will deploy some intelligent equipment in these stations. So it will help them to find the services inside this station. For example, we can see we have lots of the non-invasive physical examination and the intelligence ultrasound. We have the stitch. We have the intelligent stitch scope inside. Yeah. We will deploy some treatment equipment inside. Yeah. The first thing is that we will set up the regional electronic health record system. We have lots of the data from the central hospital, and we also from the community hospital, and we have the data from the services providers. But the innovation point is that we don't mix the data together. We just have the standard to interact all this data. The data can be stored everywhere, just distributed. We just use the model to calculate the data. So we call it the privacy computing. That's the technology we are using here. So we are using data to form the health record system. Here it is very interesting, and because all the system, you need some tools for them to verify whether this person is the virtual person on the net. We have the fingerprint, we have the face recognition, but actually fingerprint can be fake. Face can be fake. So we are using the voice print to do that. Yeah, it is hard to fake. And also we apply this technology, yeah, and we put it into a lock. Yeah, we can use all this the lock into the hospital. For example, the operation room, server room, isolation ward, office, everywhere. And also we using the AI plus our telemedicine technologies. So it can be used in the remote consultation, remote inspection, remote surgery, remote care, remote teaching, and the remote emergency. Later I will show you some example. For example here, and I don't know why the video don't show, but actually this is the dynamic video. And this application is very interesting. Actually, in lots of the small hospital, they have the ultrasonic system, but the doctor there, they don't know how to use it. For example, we need to track whether our blood has some problems. We have some plaque in the blood, but we use the system. It is easy to find out, but the doctor don't know how to use it. So we develop a system to help them. We just link our system with the hospital's original equipment. Then we get the video out. Yeah, you can see the red square. That means that's a plaque. It is very fast, and each image we just take 0.1 second to find out. And currently, this technology has been applied in more than dozens of hospitals right now, and all the doctors that are using this system just like an expert just sitting beside him and to tell him, yeah, this is a problem. Yeah, you should notice about that. And also, we developed another thing. It is our intelligent stethoscope. We will find out the sham about the disease to tell the doctors maybe there's something inside the sham of the lung, of the heart. Yeah, maybe there will be some problem. We tell them the wrong voice. We find out the wrong voice for them, but the doctor can just based on this wrong voice to make their judgment. For example, and some guys just cough. We find out whether there's some liquid inside the lung. To find out whether these guys have other problems, and maybe for the asthma control. And we developed different kinds of the AI assistant programs for the primary doctor. So the primary doctor can use all these intelligent assistants to help them to show the requirements from the residents. For example, for this one, for diabetic people, they need to control their food and their exercises. But not all the doctors, they have the ability to do that. Yeah, because it is a closed, it is a crossing field. Some people know about the diabetic, they know how to use the drug, but they don't know how to do the exercises. But some guys, they know how to do the exercise, but they don't know what kinds of food they should provide to this guy. So, and I show you one example here. For example, this guy may be from the other hospital. If they just from our hospital, yeah, we have the data just from his system. If they from other hospital, they just show us the paper, the examination, the record from us hospital. We use the OCR technology to scan their medical record. And then we can get the data out. Then we will, just based on their medical record, we will generate the exercises, a prescription. Yeah, maybe you should do some swimming, you should do some running. Yeah. The third step, we will calculate the recommendation value for the intake of their nutrients. And then we also will, based on the exercise prescription, to generate their exercise plan. Okay, since they do the exercises, they need to get more intake. So we will generate the digital we will generate finally the nutrition, the prescription for them, and maybe just for 1 week for the food menu, what you need to eat. We just recommend. We just tell them, just a suggestion. And during this period, we will generate our digital human videos based on the exercise plan to tell them how to do the exercises. Yeah, so that's we are using our LLM, large language model, to generate that automatically. And just now I mentioned that we just have limited medical resources, so we need to training more professional people to do that. So we create a new career, we call it the health care. And we just provide our AI tools for them, and we use the internet to help them to link with the doctors inside hospital. They can help the doctor inside hospital to do some health management work outside the hospital. So we just link the inside and outside, we put them together. So we use the blockchain technology to implement their license. This is an example for the license for this guy. If they get a train, and yeah, they get this license. And we gave them different intelligence tools for them according to their training result. For example, this guy, they can do the monitoring the data and evaluation, to do the evaluation. And the doctor inside the hospital, they can make plan. And the health carer outside the hospital, they just implement this plan. And so it is very interesting. Yeah, it seems that our health carer, they would be the assistant to help the doctor outside the hospital to fulfill the health management. And everybody can just attend this course. They can have this training. So they can care about themselves, they care about their family, and if they have more ability, they can care about the community. Yeah, they can do it as a volunteer. They can do it to charge money. And here is also very interesting. Yeah, because we will have lots of the skill, we want to train the health care. But how can we prepare so many training materials? So we use our AI system to do that. The first things we use the AI to extract the knowledge from the current textbook, database, or anything else. We just extract the knowledge outside. And then we will organize all these knowledge as the training courses and the training video. Yeah. And before, maybe we will prepare such the whole set of training materials. So we need 1 or 1.5 years. But now we just need 1 day. We just finish it. But why we need more time to do it? Because we still need the people, need the experts, need the experts to come to negotiate whether the final result is good or not good. Yeah.
大家好，我是今天讲课的老师。今天要给大家讲的是关于血糖监测的一些知识。
So the video is generated automatically. And before, I'm just mentioned about the digital credit, because we collect all the data about the training data, about examination data, and to collect the data from the services data, the services feedback. We put all the data together to form the digital credit for one person. Okay, so we will have lots of the data from different channels. So that we get all the data together, we will form the visual health digital space. Yeah, inside this space, we can see from the timeline, we can see how these people's health status change, and what kinds of intervention plan we give to them, and how they use this plan and how their status change. We can see them from the timeline, and also we can see their problems from the different dimensions. For example, we have the gene data. We have the other. We have lots of the evaluation data here. So maybe the doctor, they want to use, for example, for the diabetic, they want to use some drug. But from the genes aspect, maybe this drug is not that suitable for this guy. They should change the prescription. Okay, and if some emergencies occurred, we still need the emergency system to help to solve the problem. So for those, we call that for the residents, they need to be monitoring. We provide the portable, smart devices for them. Yeah, if some emergencies occurs, yeah, we will, our internet doctor will appear on his, just in front of him, or maybe his family members, to tell them what to do. We just help them to get the time. So to save the time, we have another system, we call it the Tsinghua, we call it the TIMES. It's the Tsinghua Intelligence Medical Emergency Rescue. So we call it the TIMES, save times and save life. So the primary doctor will, according to the requirements, they can go to find the patients to give them some rescued treatment. And if they need to go to the hospital, we still have the mobile hospital to go there to take this patient on the car and back to the hospital. And during the transportation, and all the status will transfer back to our hospital. And also, all the doctors, they can use their cell phone or their pad or maybe their laptop or desktop computer to see the data. So, and they can also give the opinions about how to do the treatment, on-site treatment. And when to go to the hospital, because we have lots of the diagnosis and lots of the treatment, them, so they can reduce the time when to put them to the operation room. So they will save time. And after they get the treatment and go outside the hospital, they will go to our closed loop because they are our, we use our smart devices to monitor their health again. You see here we have the cooperation with Toyota. We have Toyota. We set up a mobile hospital. Inside there are two separate spaces on this car. And from the spaces, we can do the examination, and we're using the internet to connect to the hospital. And the second part of this car, we can do the emergency rescue according to the doctor's opinions. And we also we also provide the support to the Winter Olympic for 2022 Beijing Olympic. And we also, and it is the Toyota. Toyota, they show this car on the China International Import Exports, and they say this is the biggest progress when we cooperate with China's university. Yeah, that's an example here. For example, some residents, they need to go to the drugstore to buy some medicine because he feels too uncomfortable about his tooth. But he go to the drugstore, and the primary doctor there to find his maybe he's some potential diseases about his heart. So to do some examination for him, and also ask the remote assistant. And then we find he really has some problem, and then the emergency we send the mobile hospital to pick this guy to the hospital. Then we use the MDT diagnosis and give a very precision treatment, and then this guy to be recovery. And we also use our mobile hospital to do the diary patrol for this guy. And now we have set up a intelligent specialized disease care system for different kinds of diseases in this area. And the third part is what kinds of progress we have got. This one is that we provide early support discharge services for our discharged people from the hospital. And every year we have about 1 million patients to visit the hospital, and we have about more than 30,000 discharged persons outside the hospital. So we just provide our early support discharge for them. And also we provide our intelligent management for our diabetic patients. And they can get the same services from the just inside the hospital and then go back to the hospital. They get the same management system. And currently, this system is not only applied in Tsinghua Chang'an Hospital. We have applied this system into dozens of hospitals all over China. Yeah. And this is also very interesting for those pregnant women. And when they birth the baby, yeah, they need some recovery. But it is not easy for them to come back to hospital. So we just provide the health carer. They take our portable equipment to go to their home to provide the services at home. But the doctor inside the hospital, they can get the data every time. So they can know if there really just happen something not good happen. They can ask, you have better to go back to hospital. Currently, we have served for more than 2,000 pregnant women. This is a very interesting data. Some guys, we are using this our services. This lady, she has a 8-year-old boy, but he feel uncomfortable after he born this boy, so 8 years. But she enjoyed our services just for 10 times. So yeah, we can see the evaluation report. Some data become very good, and she also feel comfortable. And we also provide the intelligence measure tools for the diabetic people. Yeah, we use the 3D scanner to scan their food, and we form the food report, and then we add the doctor's opinions, and we form their food model. We send all this data for the manufacturer. They can generate the food for them. Yeah. We can see if they have the insure, they have the customer insure, they have the correction of the Fox line. And this is also very interesting because in the hospital we have lots of the treatment solutions. We design all these treatment solutions as digital solutions. So we design a very portable treatment system. Yeah, we put our treatment equipment. They can get out, take back to their home. So we can see the case one is that this patient, the right hand cannot move. After 3 days treatment, it can move. And this is the constipation. Yeah, just 1 day. Yeah. And this is the ankle joint sprain. Yeah, the next day it is smooth. And also we have lots of solutions. And now we have more than 40 solutions inside our equipment. Yeah, we combine our mobile hospital and we combine our telemedicine system, and we using our digital drug. Yeah, this we provide these services for the remote villages. Yeah, and just in one villages, 1 day we serve for more than 100 people, and everyone feels satisfied about that. And also we have the cooperation with the Chinese government to build the China Accessible Environment Construction Law promotion. Yeah, we provide all these services for them. Okay, and in the future, we want to use our system to get the data from the real world, from the real usage, and back to our, into our clinic, to help our doctor to improve their prescription and the treatment. Yeah, so this image is just using for our diabetic management. But actually, we can use this image to more diseases. So I think AI can help us to do more things. And for the healthcare management, I think the biggest problem is that we lack of the high quality medical resources. But we use the AI plus the people together. We combine with the people together. We can do lots of things previously we cannot think or we cannot do. So I think AI will change our future. Thank you.
Mr. Bin Yang, thank you so much for sharing your valuable insights and experience with our audience at the conference. Can we keep you for a few questions?
Okay, no problem.
Thank you very much. And first question is, how do you assess the prospects for preventive medicine in the AI paradigm? Preventive medicine in AI paradigm. So maybe some assess the prospects. No, this one.
Pardon?
I can show you. Maybe,
Okay.
maybe like this. Because it's a very difficult word for me.
Okay,
I don't
yeah,
understand.
yeah. Great. And actually, the final target of our health management is to prevent the diseases. We would like to find out the basic, I mean the real reason of our diseases. And then we prevent to do that. For example, I can give you one example. That's just now I show you the diabetic shoe. And for those diabetic patients, if the pressure on their foot, we just evaluate their foot. If the pressure is not balanced, maybe some point, the pressure there is very high. So what happened? Yeah, this will be broken. Yeah, it is an inevitable process. So maybe in the future, this patient will, the leg, he will lose his leg. So it is, I think we would like to use the AI to find out the problems, and we will do some intervention, not let this happen. Yeah. And another thing is that for some guys and for the exercises, even everybody say exercise will be good for you. Yeah, that's the reasonable exercises. Not all kinds of exercises. If you hurt yourself, if you don't get a very our rehabilitations AI tools to help them to recover their pain. Yeah. So, and in the future, I think AI can do lots of things for the disease prevention. Yeah.
Thank you very much. And the next question is, how involved in Tsinghua AI in tracking the patient's condition and making a diagnosis? And what future do you see for AI in inpatient care?
Okay, yeah, that's a good question. Yeah. Actually, actually lots of companies just working on this, and lots of research institutes working on this. Just now I show you there's a big infrastructure. Actually, we link different kinds of technology together. We are open. Yeah, we for example, some for the diabetic, we will monitoring their health status, the indicators. We are using different equipment. Yeah, they are from different companies. But now we just try to make some standards to help different companies' equipment they can exchange their data just according to a unified standard, just based on the unified standard or the unified interface. Yeah. So currently we have, for example, we have IEEE P3806. That's for the liver diseases. For all the guys they want to involve in these liver diseases, they can exchange the data together. Yeah. So, and this is the base. We help each other can exchange together. And here I also welcome our Russia's research institute, research company to be join this system. And then I think for the health management, the food life cycle health management, we should have the screening, prevention, emergency, and also diagnosis and the treatment, and then to the rehabilitation. So that's the food life cycle management, not just one. So we want to link everything together. So, and that's what we are doing. And I hope everybody can join in. Yeah.
Thank you very much. Very interesting. It was totally informative. Thank you for estimable knowledge you gave. Thank you very much. This is applause for you. Thank you. А мы продолжаем.
And we are moving on. Now, everyone needs standards, especially in healthcare when you talk about AI in the future. And AIJ 2023, we are having fun during our pause, during our coffee breaks. 3 topics that were discussed, and a look at the conference hall. It has changed. And Misha Most, a street artist, already showed a window to the future. Misha, you're somewhere here. Now, what were the messages of the experts that you have gathered to build on when you were painting this mural? Well, I started with a digital artist image who is like making the art. And this is the clouds with like neural network cryptography, many other things. Like the Hospital of the Future in China, I have 45 prompts that were implemented in an image. So there was an image, and then there were some elements that were embedded into that image, and yeah, quite a lot of things. Well, I can see that our future in AI is quite bright, quite promising and happy. A lot of greenery, sunshine. Well, we were talking about that. Yeah, actually, like using AI, including in healthcare, and how it is going to serve us in terms of the healthcare. That looks interesting. This is a mural that really pushes us to the journey to the future of AI. It will be quite exciting to look at the final version when the entire conference hall will be painted with your mural. Okay, so please continue to create, and we are moving on. We're continuing with our conference, and I'd like to remind you once again that we would like to thank our partners. Russian Railroads, the title partner of Artificial Intelligence Journey Conference, our general partner, Samalot Group, the Russian Direct Investment Fund, the investment partner of AI Journey, Uralchim, a group of companies, our official partners, and Rusagro, a special partner of the conference, and Tinkoff, a partner of the conference. I would like to remind you again that the images that you see right now are being generated by AI together with Mikhail Most, and the music that you are hearing as well will also be generated by AI. And we are convening in 15 minutes for our next session, and we're having a break now.